Australia is about to experiment with drugs. The possession of small amounts of hard drugs like meth, heroin, coke, MDMA and others have now been decriminalised in the Australian Capital Territory, home to the nation's capital city, Canberra. The new laws passed by the Territory's government replaces criminal penalties for personal use possession with an infringement notice, essentially a fine, as well as a referral to addiction treatment services so addicts can get clean while steering clear of the criminal justice system. The goal? Repositioning the war on drugs as a health crisis and not a criminal one. It's similar to legislation introduced in some states of the US, Canada, and Portugal, but opponents here and abroad point to maintained usage levels and continuing overdose deaths as reasons that this compassionate take on rehabilitation is failing. So, is decriminalisation likely to work in Australia, and do we even need it? Alright, let's begin by breaking these laws down. When they come into effect in October of 2023, people in the ACT will be able to carry up to 1.5 grams of amphetamine, methamphetamine, cocaine, MDMA, and magic mushrooms. Also on the list, 1 gram of heroin and 1 milligram of LSD. But it'll still be illegal to carry more than 2 of these substances at any one time, even if the amount doesn't exceed those limits. The idea is that these amounts reflect a personal use and not the intent to sell, discriminating against drug dealers and not users. Despite these new laws, drug dealing and trafficking in the ACT will remain extremely illegal, as will being caught possessing above those personal use amounts that we just hashed out. But what happens if you're caught with drugs within this new decriminalised threshold? Well, you could get a caution, but you're more likely to get a $100 fine and a health diversion to get medical treatment for drug addiction. But if you attend that addiction treatment service within 60 days of getting the fine, you actually won't have to pay it. This treatment could be anything from counselling to rehab and everything in between. But this is far from the first time that a country or state has radically changed the way that they deal with drugs. In fact, over 20 years ago, the European country of Portugal made the personal possession of all drugs completely legal.
While still targeting dealers, Portugal says it will no longer send drug users to jail, leaving some residents fearing the consequences.
After the reform, Portuguese people seized with drugs were directed to appear in front of a commission composed of medical, legal and social services professionals, and were then directed to a drug treatment service and may have had to pay a small fine.
But the authorities in Portugal say they lost the drugs war a long time ago. They insist their new policy of tolerance is the only way forward, and they claim it's an example that other countries could learn from.
And this shift from a criminal to a health focus has been remarkably successful. Drug use in Portugal is now well below the European average, and drug-related crime and imprisonment is drastically lower than it was before drug legalisation. But what about places that have taken on the task of drug decriminalisation more recently? Well, the Canadian province of British Columbia is on a similar trajectory as Canberra, with illicit drugs set to be decriminalised for a 3-year trial starting in late January of 2023. It's mainly in response to the province's absolutely catastrophic opioid epidemic, which has claimed more than 10,000 lives since it was declared a public health emergency in 2016. Under the trial, people found with drugs will not be arrested, charged, or even have their drugs seized, and instead police will just direct them to available health and social services in hopes of minimising their risk of overdosing and getting on the road to recovery. But probably the most relevant comparison to Canberra lies just below British Columbia in the northwest American state of Oregon, where the possession of small amounts of hard drugs have been decriminalised since February of last year. So, have these new laws actually worked to help minimise the harm of hard drugs? Well, it depends who you ask. Law enforcement in the state are adamant that the laws came into effect well before the addiction treatment services required were available. Since coming into place, the laws haven't been able to stem the tide of rising overdose deaths, with accidental opioid overdoses nearly doubling in Oregon from 2019 to 2021, which the Oregon Health Authority has said was caused by the increased use of the incredibly powerful synthetic opioid fentanyl. Critics of the law, like Portland Police Association President Sergeant Aaron Schmaus, say the decrim effort in Oregon has been basically a disaster because the increased addiction treatment services that were promised as part of the laws never materialized, despite massive funding allocations generated from the taxes paid on legal cannabis sold within the state.
Lawmakers are in their positions to hear from their folks, from their citizens, and figure out the best way to navigate their laws. The most important thing is anything like this requires treatment to be fully in place, requires those off-ramps to be to full fidelity up and running before kind of the curtain is lifted, because if we don't, we've seen in Oregon what happens. There's no treatment, and there's also more drugs, and those are two bad things.
The rollout of services was so dire that a December 2021 report found Oregon ranked number 1 in the US in the percentage of citizens with a current or recent illicit drug use disorder, and dead last for people requiring substance use disorder treatment services that couldn't receive them.
We're seeing a lot of kind of growing disorder related to addiction issues with no real ability to navigate them. We're still seeing very small amounts of citations towards treatment. It's not a real practical way of navigating those issues. And so we've definitely seen more overdoses, more addiction issues, and not a lot of treatment being sought.
Repositioning the war on drugs in Canberra as a health one and not a criminal one comes at a time when Australia has seen national drug arrests double over the last decade. The majority of these arrests have been for cannabis, which has actually been decriminalised in the ACT since early 2020, the only state or territory to have yet done so. But we can see here how cannabis and amphetamine arrests have continued to climb significantly, putting more and more people through the criminal justice system across the country, with basically no sign that Australians are going to stop using drugs anytime soon. Also, the vast majority of these arrests were consumer related and have no connection to the trafficking or selling of illicit drugs. So lawmakers in the ACT are hedging their bets that turning a criminal issue to a health one will do a better job of minimising the harm of drugs. The ACT now has easily Australia's most progressive drug laws. Like I said, growing and possessing certain amounts of cannabis has already been decriminalised here, which at the time was already the most controversial drug reform law the country had ever seen. But you're probably wondering why the ACT is passing these laws now. Well, there actually isn't much, if any, proof that the territory is going through an overdose crisis similar to that like we've seen in the United States. The Bureau of Statistics reported 3 accidental drug overdoses in the territory in 2020, the same number as alcohol-related deaths. And overdose hospitalisation rates in the past 3 years also don't paint an alarming picture for the territory. But we do appear to have a relatively high number of drug users. The latest National Wastewater Drug Survey found the ACT had the second highest cap city consumption of heroin and oxycodone, and that the average consumption of every drug tested for except cannabis actually increased from the first quarter to the second quarter of this year. But the question remains, why pass these laws now, and why in the ACT? Well, it's because they can. The Labor Party has held on to power in the territory for over 20 years now, with a long history of pushing for progressive policies like being the first state or territory to legally recognise same-sex couples in 1994, as well as leading the charge among other states and territories for the legalisation of same-sex marriage. So you can kind of see how the territory's cannabis decriminalisation laws were a first step towards these more radical drug laws being passed now. The territory's also small, with a population of less than 500,000 people, which makes it a uniquely placed guinea pig to stress test new laws like these. And ACT Chief Police Officer Neil Gagan is hyper aware that if this experiment pays off, you could see laws like these in other parts of Australia.
So I think the Canberra community is by far the most educated community in Australia. Every other jurisdiction is watching what we're doing. I don't think we can lose sight of that. I think we've got to try something differently, and I think this is the jurisdiction we can do it, and I'm very optimistic that we can have a successful outcome.
The shift from a criminal approach to one of health and rehabilitation is something local and federal police are in agreement with, but there are still concerns that dealers will be able to pretty easily use the laws to their advantage, according to Australian Federal Police Association President Alex Caruana.
So if I was a drug dealer, if I was organised crime, I would have my henchmen out there with the prescribed limit or with the maximum amount limit, going to these nightclubs, going to these places where they can sell the drugs, where they've got them bagged up into personal use amounts, and they can start selling them. Then when they're finished selling those amounts that are on them, go to a watch house or a house that they can collect more drugs and go out, rinse and repeat.
So, here in Canberra, local health organisations are doing everything they can to avoid the pitfalls of Oregon's decriminalisation woes. Directions Health Services are the biggest provider of addiction treatment in the ACT, and Director Stephanie Stevens says that although there are a lot of essential services already in place to help addicts and their families, they'll still need to be significantly scaled up before these new laws go online.
We need an increase in the number of treatment places here in the ACT, but in each mode and type of treatment available, so in bed-based, community-based and harm reduction-based treatment options. We need to cater to the full spectrum of substance use and the range of needs that they present, so that then we can really give an appropriate treatment match and treatment dose to get the best outcome for someone when they need it.
Now, we are nowhere near the amount of drugs in the community that we were post or pre-COVID, but we are tracking upward, and I think we'll know very quickly whether or not this has been a success based on our ability to check the wastewater, to see how many referrals have been made to health services, and they've got to be, on the ball, ready to go 24/7.
We already know that we're well over in terms of demand versus supply regarding AOD treatment here in the ACT. We've known that for a long time. We do really hope there'll be an investment to increase the number of treatment places.
In recent years, the ACT government's invested over $30 million into boosting addiction treatment in the territory, and Health Minister Rachel Stephen-Smith says the government's committed to making sure treatment services meet the demand of decriminalisation.
We're going to continue to monitor demand for services once this legislation is passed. We've got a review period built into the legislation so that we will formally review the impact of legislation, but alongside that we will continuously monitor the demand for services and continue to work with our government and non-government providers to make sure that we are addressing those changes in demand as we see them.
Unlike the state of Oregon, the Australian Capital Territory is going into these laws without a massive drug epidemic playing out in real time, which should theoretically make the transition a bit smoother and not cost people their lives if it's not perfect. But the government here is apparently still keeping a pretty close eye on what other countries are doing in hopes of avoiding a lot of their mistakes.
We have a fantastic policy team that's really plugged into the national and international evidence in this space, as well as working with people with lived experience and our fantastic non-government providers. So we'll continue to learn the lessons from implementation overseas. We already have a very strong service system and we'll continue to grow that in response to increases in demand.
Australia's decriminalisation journey has officially begun. After decades of Australian authorities fighting and ultimately losing the war on drugs, the city of Canberra is now assuming the role of a guinea pig, with the rest of the country watching on to see what happens. After billions of dollars spent, countless arrests and thousands incarcerated, Australia is now on a new path to see whether decriminalisation is the way of the future.